Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's the topic is about stop the COVID-19, what really works when it comes to masks, N95s, and the respirator. We are so pleased to have two members of the Canadian Aerosol Transmission Coalition members, Simon Smith and Dorothy, joining us to present it today. Simon now has been recently retirement from a 35 years career designing respirator filters and test methods. Simon is still involved in leading roles with development of respirator standards for Canada and internationally. A past president of the International Society for Respiratory Protection. He participates in various industry organizations and is currently now working on the new respirator performance standard for Canada and on new tools to make standard more accessible for the respirator users. Dorothy Wigmore, she was the OHC first occupational hygienist. Dorothy is also a mapper, ergonomist, stress specialist, educator, researcher, and writer now living in Ontario. Aside from volunteer with the Aerosol Transmission Coalition, during the pandemic, she was written worker-friendly materials for the U.S. education unions and the OHC, being inspired to write a book about workers' experiences in the pandemic as a result of government failures to accept airborne transmission and precautionary approaches. We would like to begin by acknowledging that we are on the Treaty 1 territory, the traditional territories of the Anishinaabe, Greek, OG Greek, Dakotas, and Diné peoples, and the homelands of Métis nations. We respect the treaties we were made on these territories, and we acknowledge that we are treaty peoples. At the Occupational Health Center here, we commit ourselves to a process of reconciliation with Indigenous communities. So for the participation here, you could ask the question to put the question on the chat box area here on the right side of your screen. The presenter will try to answer it after the presentation. We may not be able to answer all the questions in the Q&A session, depends on the time constraint, but please connect with us afterwards to follow up. And this event is now being recorded for review later, so and share on the social media. I will send you the link to watch later on. And please also participate in the follow-up evaluation survey, giving us some feedback for upcoming events. Occupational Health Center is currently located on 167 Sherbrooke Street, Winnipeg, Manitoba here. We are the community health center funded by the Winnipeg Regional Health Authorities. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committee and for training. Our services are free. And please also our website for more information and resources. Now, this is the time. Please join me to welcome Dorothy and Simon.
Thanks, Tiffany. Real pleasure to be here again. I wish I was actually there in person, although I don't know whether your blizzard is hit yet or not. It might be difficult. So I'm going to share my screen and start the, hang on just 2 seconds here. Gotta, all the joys of technology. So the one thing that I didn't get into that bio is that I used to work for what was then called the Workplace Safety and Health Division in the Department of Environment and Workplace Safety and Health. And so that perspective helps to inform what I'm presenting today. So we're calling this Stop COVID-19 what really works when it comes to respirators. And I'm asking people, and you can hang on to your thoughts for the moment, but what do you think Teresa Tam is wearing here? Is this a respirator? We're going to find out. But before we get on to the actual stuff about respirators, I just want to review some important things that put this in context. The coalition, towards the end of December, came out with this material about the need for all layers of protection to the max. Clear the air, mask smart, and close the gaps, we called it. And we called on governments and other organizations that have decision-making power to do a bunch of things that make it easier for people to get ventilation, to clean the air, to get respirators when needed. Unfortunately, Manitoba's messages still focus on what, I'm borrowing a phrase from others in the coalition, fallacious fundamentals that are based on the idea that the virus is spread by droplets. They talk about a mask, including a balaclava, a bandana, a scarf, which is not exactly what others use. Talk about COVID spreading by infected people spitting, and therefore you can reduce your spread by wearing some kind of mask. They talk about distancing, the need for plexiglass barriers, and in fact, if you've got them, you don't have to distance. I remind people that the virus, if you think of it as a smoke, that might not make a lot of sense. And they're saying that the regular use of respirators is not routinely recommended unless you're in a particular situation within healthcare, or, and in fact, you don't actually need to even wear anything if you're behind a plexiglass barrier. This is really out of step with scientific reality, Manitoba's own health and safety laws, and what we really need to protect workers in particular, but the rest of us as well. The evidence is overwhelming that the virus is in the air. As Teresa Tam says, think of it like smoke. It's the law of physics about particles. The word airborne, unfortunately, does not appear in Manitoba's COVID-19 web pages. I checked again yesterday, and aerosol appears once with droplets about the use of masks. The rest of the world talks about airborne and aerosol a whole lot. And unfortunately, again, and this is not unique to Manitoba, public health is supposed to include occupational health, but that's really been ignored. And there's no evidence that folks like occupational hygienists, ventilation engineers, respiratory protection specialists have had any input in the public health orders or messages. For example, we know that the 6-foot distancing really is not very good and sufficient in an indoor space for when you're dealing with something over time. Safe Work Manitoba also is towing this discredited only droplets matter line, and their materials around respirators saying essentially keep them for healthcare workers. A medical mask is just fine, but you got to even keep those for healthcare workers and those in high risk environments. And they're recommending non-medical masks. And you're going to find out today that these really are not the thing to be using. Workplace health and safety seems to be ignoring its responsibilities or not being allowed to do its job. Again, this is not unique to Manitoba, but you know, they say on their website they're trying to protect people, make sure folks are healthy and safe. And when it comes to COVID-19, they're looking at enhanced sanitation and hygiene practices, totally unnecessary when there's no droplets to worry about. They're talking about social distancing, barriers, again, not effective except in certain circumstances, and protective equipment. The question is, what about ventilation and cleaning the air? And I just want to remind you, and this goes back to my days as a safety and health officer, that the purpose of the health and safety law, as Victor Rabinovich and others wrote it back in the 1970s, is to protect people's health and safety from things that arise in the workplace. The employers are expected to do that, to provide and maintain a workplace equipment, systems, and tools that are safe and without risks to health. And when it comes to personal protective equipment, employers are expected to provide it, including in the event of an emergency in the workplace. So 2 years into a pandemic, it may not be an emergency, but certainly when it started, it might have been seen that way. And not everybody remembers this, but you can actually lay charges under the Act. This Section 58 says anybody can do it. You got to do it within 2 years. So when it comes to respirators, Manitoba has very unique respirator rules that come out of the health hazard regulation that I helped write. And it essentially says that, and it's the only one in Canada as far that directly says that employers have to provide respiratory protective equipment using the Canadian standard called Selection, Use and Care of Respirators, or some people call it Z94.4. Manitoba is not up to date on this. They're using the version from 2011, but that still is a very important one. And it's actually unique in the world because it deals with the kinds of bioaerosols, as they call it, the virus. So Simon, tell us more about respirators.
Thank you very much, Dorothy. And thank you, Tiffany, for the very generous introduction. Got quite a lot of slides, and they're fairly wordy, and I apologize for that, but I hope that it will be a useful reference after the presentation. And I'll just move to share screen and go from there. Thanks. All right. So I was going to talk about respirator aspects, summarized as what you need to know about masks, N95s, and other respirators. And really going to cover what is and what isn't considered a respirator, what to look for in the different types of respirators and the approvals that apply to them. And then in terms of the function, what actually matters, what's the most important things to look for. And when it comes to selecting the right kind, what the standard says that Dorothy just mentioned, and examples of applying that. So that's really the core part of the presentation. There's a lot of information here, and there's a reference table and some supplementary slides at the end as well. So we'll have more information in. When it comes to personal protective equipment, I think people are probably fairly familiar with the workplace programs. Because the Canadian standard for selection, use and care of respirators applies, to use respirators in a workplace, you have to have a program in place that includes evaluation of the exposure environment, following guidance on selection based on knowledge of the exposure environment, the properties of the materials involved, and the capabilities of respirators, and then using respirators that are approved to a recognized performance standard. Now, I'll cover some of these aspects in more detail in a minute. And of course, in a workplace, you are required to wear a respirator where it's warranted and compliance is observable. And the focus is on wearer protection. And I think people are familiar generally with the hierarchy of controls, recognizing that personal protective equipment is at the bottom end of that, and that there should have been other measures, as you see there, to eliminate, substitute, or control the exposure with personal protective equipment used as the last resort. With the issues of COVID and the general pandemic needs for public use of protective equipment, we see quite a different kind of environment, and this is sort of reflected in popular knowledge and understanding of the properties of this equipment as well. We have mask mandates, and they may be applied as all or nothing. You may have one day you may be required to wear a mask. Yes.
Simon, you're a bit choppy, and
yes?
several people have noticed this. Is there anything you can do at your end to see?
I'm going to, yes. Yep, I will actually cut my video. Sorry about this. Won't be a minute. Sorry, I'll just I've stopped video, so that I hope will help.
And now, now you need to get back to your slideshow.
Is that any better now?
Yes, the sound is better. We need to see your slideshow, though.
And yeah,
the joys.
Yes. Oh, have you lost the screen share?
No, yeah, it's back.
Have you lost the screen share?
Yes, it's back at the start now.
Okay.
The joys of using Zoom.
Yes, isn't it just? Okay.
Okay, there we are. Looks good. And it sounds better. Thank you.
Yes. Okay, that's good. Thanks. Thanks very much. Sorry. I will. Yeah. Okay. So just one difference between public use of equipment and workplaces is that we have mask mandates there, maybe or nothing, which kind of gives an odd message to the public and workplaces that may be using masks for COVID protection. We have a great variety of products. There are in fact some standards, but we don't have those in Canada. But there's no requirement to follow selection guidance to pick something meeting a standard, and it's actually the manufacturers of these standards that by and large certify the performance, not some agency that does it for respirators. And of course, very inconsistent and uncertain wear compliance. The focus in this case is both wearer protection and source control. So overall, we've got a sort of mix of understanding and as Dorothy had mentioned, from a high level, sometimes confusing requirements in place and sometimes statements made that do not really comport with what we would understand from a general occupational health and safety principles background. The key aspects that are important, and I'll come back and focus on each of these later, when it comes to addressing respiratory protection, when you want protection, can be simplified as the 3 Fs for filtering devices. And it's easy to remember this: filtration, fit, and function. And all of these are necessary. Focusing just on filtration and the high efficiency capabilities of materials for filtration isn't much use if the product itself doesn't fit well to the face, and incoming air can leak around the periphery of the device on the face, and so you aren't getting protection from that. And if the function is poor, if it's very hard to breathe through, or it blocks you from speaking well, you're going to have situations where people will remove the product from their face as much as they can to relieve the effort they have, or remove it to talk. And so again, in those times, they're not getting protected. So all of these things have to be together to have effective respiratory protection. When it comes to the products that people are using, we can really put them in 3 categories. There's a sort of spectrum here, but in general terms, we have the cloth type masks that one can generally term barrier face coverings. In European context, it's called community face covering. And we see a huge variety of these. And as we see, these don't generally seal well to the face. They're made from just about any kind of material. Various claims are made. Sometimes there are magic new materials that emerge, but really they are modest efficiency at best. And as I mentioned, there are then surgical masks or medical masks that are used, and as I say, we see these in healthcare and by the general public. Again, a key factor with these is they do not seal well to the face. They are never designed to. They can filter, some have filtration efficiency, and they may be splash resistant so that they can penetrate, actually meet them. And then we have approved respirators, which are designed to have a good seal to the face. And they are designed also to have very highly capable filtration material, and there are strong regulations and standards that govern their use in workplaces when they're applied. When it comes to comparing the 3 Fs and some other factors, we see that for the barrier face coverings, things are pretty modest. Function isn't at the bottom because basically they're not that hard to breathe through because you're breathing around the material instead of through it. They do function well as source control. Surgical masks, better filtration, again, very poor fit. Function, again, not too bad because of the low breathing resistance. And yes, they do have good splash protection and can act well as source control. But it's really approved respirators that tend to stand out in every aspect. Good filtration, good fit, good function, and there are limits, the standards on the airflow resistance, for instance, that one of these products can have. And manufacturers are competing with each other to kind of drive to lower breathing resistance, because that is something that people want. Splash protection is pretty good. There are versions of respirators that are actually set for splash protection, so-called surge respirators. But even ones that don't have that classification, when they were being tested, the US lab has drawn some at random, found that they pretty well all met the basic standard, and some even met the higher standard of splash protection that surgical masks have. So you are getting some protection from these when they're used for splash protection. And they're excellent source control, again, because they fit well to the face. So this is the choice with variation in between of the types of product that is available. And one can see that if I had a preference, one would go to the approved respirator side. Some of the other differences that you can see here, sorry, a bit of a complicated table, will also one thing.
Simon,
first of all,
Simon, we've got
one is woven materials that may be used.
Simon,
Yeah.
I'm sorry for interrupt you. Your sound is still choppy.
Yes.
Anything you could do from your end?
Okay.
Are you using
Okay.
kind of? Yeah.
What I'll do, if you excuse me a minute, I will try and dial into this meeting through my phone and use the phone for sound, and that might help, because that's not on internet, that's on.
And while you're doing that, I'll explain the slide that's up there, Simon, if that's okay.
Thanks, yeah, that's great, thanks. Yep, go ahead.
Thank you, Doc.
Yeah, so
very sorry about this, it's got to where I live.
Yeah. Simon lives just outside Kingston, so it's intermittent sometimes. The thing that's really important here is if you look on the, Simon is here wearing a cloth face covering, and you can see the fabric type is woven, and that really doesn't stop very much at all. The surgical mask, this one in the middle, is non-woven, and it's typically got 3 layers, but it's got an ear loop. If you look carefully at what Teresa Tam was wearing, that's one of the things that we look for in the difference between surgical masks and respirators. And you'll see here, not only does the respirator have 2 straps, so you'll see Simon's highlighted here, goes so it can go around the head, but it also has these special filtration materials that are designed to catch small particles. Simon, over to you.
Oh, thank you. It'll take a minute to get the new sound. I hope you're okay with me carrying on at the moment.
Yeah, it sounds good.
Much better. Thank you, Simon.
Okay, thanks. Well, nothing's changed yet, by the way, so it may go bad again. I've got to download the app, of course, because that is the way things work here.
Right.
Yes, so you have these different attachments. Thanks very much, Dorothy, for taking that off, and different materials used. And this leads to the differences in capabilities. So,
and I'm happy to do the same thing, Simon. If you
from Canada showing, actually, okay, is the sound okay?
No, we're not seeing the slide
sorry,
quite.
I will. Okay. Thanks. Okay, sorry, I'm just.
Yeah, well, you do that. So this Masks for Canada
phone
is one of the organizations that we work with, and they have this very useful graphic that shows that starting with on the left here with the cloth face coverings and going to, they're showing some kind of respirators, that there really is a difference in both filter and efficiency as you move up from face coverings through surgical and non-medical masks to respirators. Simon, we need you to advance the slide, please.
Yeah, okay, thanks. So,
okay.
So now I hope you can hear me better. I've switched over.
Yes, but we need to see the slide.
Yeah, okay.
Masks for Canada slide.
Yes, sorry. And I have switched it. There will be a slight lag, I'm afraid. And I'm just aware of this. There we go. No, it's thinking about it. Gosh.
Yes.
Apologies, everybody, for my poor internet. It's rural broadband.
You have no control over this, so.
Not reached 10 minutes from downtown Kingston to drive. I get 10 minutes from downtown Kingston to drive, but we have rural internet. So you're seeing here a schema from Masks for Canada showing us the spectrum of products from the cloth mask range up to a level of elastomeric respirator, showing that across that there is an increase as one goes from the cloth mask to surgical mask to ear loop respirators, and then to different grades of filtering face piece up to elastomeric, an increase both in filter effectiveness and in fit effectiveness.
There are various techniques you can undertake to improve the fit with surgical masks and other types of product. But again, when you want to look at the best capabilities, you are looking at the approved respirator end. And the arrow on the right actually indicates that going on from there, you have then an add-on range with respirators. And getting into that, there is, I will start talking to the slide, it will gradually appear. We have a spectrum of respiratory protective equipment of increasing sophistication. The table here is kind of showing a number of features about it. First of all, I'll mention the filtering face piece, again, is where the last one left off, and half-mask elastomeric respirators. These, for the purposes of respirator selection, where a calculation is undertaken, where there are products that have a occupational exposure limit, there's a sign protection factor used in the calculations for their selection, and that is 10 for both of these. And in a sort of numerical hierarchy, you can say these on the respirator scale are level 1. And then we go up with increasing assigned protection factors, increasingly protective equipment through loose fitting powered air purifying respirators, to full face piece elastomeric, tight fitting respirators, and then in powered air respirators, and then into self-contained breathing apparatus. The assigned protection factor increases across this range. I'm sorry, apologies, that isn't two. Some things have shifted down there. Sorry, it's 25 and 1,000 for it's 100 for that. Sorry about that. And that's 1,000. Sorry about this. Just realised that something had moved there. And so we have increasing levels of sophistication, higher protection, but also changes in the costs and the logistics and complexity of using the equipment. So you effectively have a choice there as to how much one is willing to pay generally upfront, and the level of protection and other features such as comfort that are achieved. But just to say, when we're talking about the protection, it doesn't stop when you reach the elastomeric half mask. That is something that is commonly used in industry. It does go up to more sophisticated levels of protection. We'll return to these sort of 1, 2, 3, 4 numbers later on. Just to mention about surgical or medical masks, surgical masks that we see used. We see still some recommendations for the use even in healthcare. They do provide some source control, as we talked about. They are in fact designed to stop a surgeon expelling material, spitting as it were, into the patient they're working on. But they were never really designed as respirators. In fact, the standard that covers the filtration testing here, quoting from the preamble of this standard, says that the test method does not ensure that the wearer will be protected from biological aerosols, and that if respiratory protection for the wearer is needed, a NIOSH certified respirator should be used. Very, very bare statement. And so, again, as Dorothy has pointed out, where we're seeing governmental authorities and others advocating their use as a protective measure, this is quite contrary to even how these products are defined in the standards that govern their performance. When it comes to use of, I'm sorry to focus on healthcare for a minute, but other types of respirators in healthcare, this is not something I'm just throwing out there as an idea. In fact, it's been well studied. The US National Academies of Sciences, Engineering and Medicine have a committee that actually advises CDC, has initiated some studies over the last 10, 15 years, and that they have examined the use of elastomeric respirators in healthcare and considerations for their use, and also looking at powered air purifying respirators in healthcare, and found it quite acceptable. In fact, some companies specifically design powered air purifying respirators for use in healthcare because of the advantages that they bring. And just to backtrack onto the medical masks thing, this is a bit of a naughty thing we did, but it was looking at comparing a fit test for a surgical mask and one's hand over one's mouth. And in fact, they are pretty well comparable.
We may return to that.
We will, yes. Both have a factor of about 2. So think about that when you're seeing guidance to wear a surgical mask, because it's actually, yes, it's probably a lot easier and cheaper to use your hand. Okay, On to the types and approvals of respirators. Just to say, again, considering healthcare and other workplaces, these are some of the designs that we are getting familiar with. We see in use. Certainly the filtering face piece, the so-called N95, and although N95 is a performance standard, we tend to associate the word directly with the filtering face piece type product. These are modest in cost. They're not absolutely cheap, but they are reasonable, but they change very often. Again, some of the requirements for dealing with patients in healthcare may change, sometimes mandated change after every patient. That's something that, of course, consumes a lot of product, but in general, they can be worn for a full day, and if they're not damaged, distorted, or unusable in some other way, leading to poor fit, they can be used again. But we see in some cases elastomeric face pieces used, again, common in the industry, covering the nose and mouth. There are also full face types that cover the eyes as well, where eye protection is needed. These have a slightly higher initial cost, and the filters do cost, but they last a lot longer. They're not changed out anything like as frequently. And the reason one might change filters is because they get clogged up and get hard to breathe through. And that can happen in dusty environments. So mines, woodworking shops, those kind of environments are where filters will get clogged. Again, in healthcare, they're not seeing any significant dust loading, so that will mean, again, the filters can continue to be used for months before there's any reason to change. And some you see here that are sort of encased, where the filtering material is actually protected from the outside, from splash or other things, again, have potential for very long periods of use. And then probably perhaps less familiar to people are what the powered air purifying respirators, and there's a couple of examples put here. One is a half-mast type, where you have a neck-mounted blower and a filter. Blower draws air through the filter, feeds it round to the face, or face side. And you can see there's a transparent covering so that the mouth can be seen. And this particular model has an exhalation filter as well, so that as air escapes the device, because protection is provided by the general release of air from the device that stops material getting in, that air is filtered too, so that there is concerns about potential infection from the wearer getting out is actually controlled in this design. And other designs you see on the right, less of a sort of nose cup than the hood. They come in various styles. First on the left there, a loose-fitting hood that again gives visibility to the mouth. So in certain healthcare situations, that's very advantageous. For all of these designs, the wearer doesn't have to breathe against the resistance of the filter. They get an airflow and they get a bit of cooling. So the comfort is much higher. And the one on the right is one used in heavy industry. Hard hat incorporated, welding shield incorporated, so that and the blower is on the back, one of a rechargeable battery, and that's a sort of thing one would see in a manufacturing shop. Again, widely used. That's an older design, but modern ones still fulfill the same kind of function. So there are multiple designs of powered air systems to suit the application required. So these are some of the examples of those designs of respirators I was talking about. On a effectiveness scale for fit coverings and respirators, just to say, this is again layout prepared by OCAW, Occupational Health Clinics for Ontario Workers, again showing the relative efficiencies of different types in terms of capabilities, combining that fit and filtration capability. We see, again, getting into the respirator side, fit tested respirators much higher than the masks and gaiters type of thing, and the respirators taking off beyond that in terms of their capabilities. One issue with the powered air and the elastomeric face pieces is the perceived higher cost. And here's quick calculation that had a look at. Although the filtering face pieces are cheap and require minimal training and so on, they cost that up with use. And there's both a purchase cost and an environmental cost. The powered air devices have much higher upfront costs, but they can be cost effective in the long run because of the lower use of consumables. There's a sample calculation showing over years, up to 10 years, say, for one person, using disposable elastomeric and powered air respirators. And you can see the cost of the disposables just keeps on climbing. The green line covering elastomerics, again, slightly minimally higher initial cost and lower cost over time, because the filter consumption is a lot less. Powered air, higher initial cost, but eventually the operating costs become into line. But you are getting, for that extra expense, better protection, more comfort, and that can result in better wear compliance, less fatigue of the wearers, and so overall fewer infections in the workforce and community. And so powered air purifying respirators are a good option for both healthcare and other workplaces. I'll comment just a bit on this, that standards have driven powered air respirators to be generally somewhat bulkier and more expensive than they have to be in every circumstance. There's only been one level of performance under the US regulations that cover them right now, approval requirements, and that has been for heavy industry. And so hospitals have been using equipment that actually has to meet heavy industry requirements, which is, as I said, makes them bigger and more expensive than they need to be. New standards were brought in April 2020, which will give the opportunity for manufacturers to make smaller and lighter, we might hope cheaper products to serve healthcare. We talk about approved respirators. I thought I'd better put a slide in saying, what does approved actually mean? Because it sounds good, but what are the consequences? So respirators are submitted to some kind of agency. Generally, the one we use in North America is the US one right now, NIOSH, National Institute for Occupational Safety and Health. And they have a protocol for submission and then testing and then ongoing evaluation of the performance of the products. First of all, an approved respirator has been tested and shown to deliver a minimum high level of performance, filtration and overall protection. We can have some arguments about the differences in fit testing protocols and things that they have, but generally you are getting a good guarantee of performance out of an approved respirator. They also, in the approval process, examine records from the companies and make sure that they have good quality control in place and they keep good records. And that can be useful to say something goes wrong and they have to do a recall. You want those records, of course, to be accurate. Another thing with approved products is that the authorities review the design. That has to be submitted, and manufacturers can't change the design of the respirator without consulting the approval authority. And sometimes, if it's a minor change, they're just substituting perhaps one type of screw for another manufacturer's product. It doesn't matter so much. They will just allow that with some superficial checks. Other times, they may require complete resubmission if it's a major change to the product. And so there is good control of that. And also, as well as the production sites are audited, so that every system we have in North America, every 2 years, every production site is visited by the agency itself or by someone they appoint to verify again that the appropriate controls they mandate are in place. And also, samples are purchased anonymously and tested in the labs so that they verify ongoing compliance again. And if companies are found to have product that does not pass, they can be called upon to withdraw that product from the market. And it's issuing a recall notice so that anyone who's actually got the product has to be will have to stop using it. And just to mention, approvals cover a system. So when it's something like an elastomeric face piece with filters, the approval covers the entire combination, not separately the face piece or the filters in North America. And so that means that if a company is saying, well, our filter for this elastomeric is approved by an NIOSH, that's actually technically an incorrect statement because it's a filter and mask combination or face piece combination that is approved, not just a filter. So it can be assured that in the combination that's being provided, the system works. Those are all the things that approved means, and that's why it's quite important when we talk about approvals and what's going on. In North America, sorry, it's a very wordy slide, and I was trying to get this to come up in sort of sections and it wouldn't do it. So what we have in North America is an agency called the National Institute for Occupational Safety and Health. It's based in Pittsburgh in the US, and that is undertaking three functions, in fact. It sets standards, it conducts the testing, and it issues the approvals. It's all in one place. In places like Europe, this is split between different agencies, but in North America, an Irish lab in Pittsburgh has done all of this work. So Canada has historically accepted that approval, and the reason is when health and safety laws were set up in the 70s, all the product was manufactured in the US and sent to us from there, so it made sense to do that. Now we have homegrown manufacturers. In fact, particularly with the pandemic, a number of companies started up and went then to try and get approvals at NIOSH, which was pretty well overwhelmed. They worked extremely hard to work through all their approvals, but they did prioritize US companies over non-US ones. And so we had an issue that Canadian manufacturers could not get approvals, and that was contributing to an ongoing shortage of respirators in the system. And so to help alleviate this, Health Canada created an interim specification in August 2020 to allow certain kinds of respirator for use in healthcare, and that their requirements approximated the NIOSH requirements. They added a few extras in there. And following on from that and replacing that interim specification, the Canadian Standards Association has created a new standard, something I've been involved in, which was published last November. And this is a part of an overall approval system, which is now in place, so that Canada has its own approvals, which is quite exciting. It's normally 3 or 4 years to create a standard. This one was done in 10 months. And this is used in parallel with NIOSH. So existing companies already have approved product, don't have to make any changes, but it does allow a faster route for new Canadian manufacturers to be able to supply product in Canada. And currently, it's only particle filtering respirators. That was the priority, of course, but it will expand to all types in the future. That is gas and vapor, CBRN, and even breathing apparatus, we anticipate. So this will be an entire parallel system. So what you'll then see are some different designations that are going to appear beyond, say, the N95 type designation we are familiar with for respirators. So the table on the right shows some of these and how they compare. NIOSH uses N95. It has this class for surgical N95, which is where the product meets N95 requirements, but also can have particular splash and flammability testing undertaken by the Food and Drug Administration in the US. There's 2 separate approvals in one product called a surgical N95. In both Health Canada and the CSA standard, we have taken those as new classes in the same integrated structure as rather than a separate sort of add-on thing. And then, as you see in the table there, for the Canadian standard, we have actually added CA- in front of N95. This is because NIOSH is actually moving to protect N95 as having specific meaning. Health Canada went a different route. They call these 95 PFEs. So you may see these designations on products. And that fluid resistance was covered by adding L for liquid, I guess, to 1, 2, or 3, according to the level of protection in Health Canada. In the CSA standard, we just meet level 3. Some products, like the P100 used in industry, didn't have anything in Health Canada. They are covered in the Canadian standard, as is powered air. But a special feature of the Canadian standard is that we have some breathability requirements. And I'll explain this a bit more later. But one issue that came up in the discussions for the development of that standard was the problem of the resistance of the filter, airflow resistance causing fatigue. As you have to breathe against resistance all day, it makes people get fatigued. And again, we have issues that they remove the product in order to get some relief or to communicate, and so get less protection. We actually put options in the standard here so that people can select a respirator right up front with a designated resistance. The 343, that's an odd number, but it's actually the value in pascals that translates to what NIOSH have as their limit right now, is the upper limit. And then there are lower resistances, 2 levels there, 175 and 100, that manufacturers could opt to have their products evaluated for, to demonstrate that lower airflow resistance and again, the better breathability. So the inverse of that. This only is done for N95 type products, but it will, again, enable people to select products that perhaps better suit their needs right up front. So those are the standards there. We only see N95s and some 95 PFE types right now. In the coming years, we're going to see the CAA 95 classifications that are coming in. And there are more of these, of course, and as a reference list at the end, you can actually look at the standard online and see more about it. Just to mention some other standards that we deal with in North America, particularly with the pandemic and the shortages resulted, other standards or other products from other standards have been introduced. So we may have heard of FFP2s and FFP3s. They match kind of N90, actually they match P level, and everything that a P does, an N does rather, a P can do as well. It means they're just oil proof as well as being capable of removing non-oil aerosols. And I can go into more detail on that if you want. As in Europe, everything is tested both with a salt aerosol and with oil. And so they're quite comparable. From China and Korea, we have ear loop style products, again, that may have comparable filtration efficiency, but generally ear loops do not give as good a fit as the headband type respirators. NIOSH itself will not approve an ear loop respirator. One issue that's arisen, though, is, of course, the problems of, with shortage, issues around anything from full counterfeit to just misleading claims about respirators in order to be able to sell them. And NIOSH, this approvals agency, is very well aware of this. And in fact, there are, it has web pages that give guidance on spotting these questionable products. It seems to me they break into three levels. One is the sort of misleading claim, where a product is called N95, but it isn't actually an N95 product. Now, it seems odd. It can be done, though. It's not illegal. So some companies say they use the N95 as their product name. But when you start to look through the details, in fact, it hasn't been approved to be an N95 product, but there's actually no restriction against that now. That may be coming in. One issue here is that NIOSH does not approve ear loop respirators or those for children. So if you see child size N95, that doesn't mean it's going to be NIOSH approved. But in this case, the companies aren't claiming the approval. They're just using the name in a kind of misleading way. But there are actually those that have a fake approval. They try and make out that the product is NIOSH approved. And they may, because NIOSH gives a number to each of its approvals, they may use another product's number, or maybe just use misleading graphics and so on that indicate that it's NIOSH approved when it's not. And perhaps the worst case is a counterfeit respirator where it's actually copying another manufacturer's product. And it looks like, some a 3M or another company's product, but and has all the markings on it that look genuine. But in fact, it's made by a completely other company, and probably what it's made with isn't capable in any way like the proper respirator. And so if you can visit again the websites of companies, and they give guidance on all of the issues that they spotted with this in terms of certain lock codes may be designated or used by the counterfeiters, and they can be identified and so on. So you can spot that. So what to look for overall. The diagram there shows that you will see on the product the approval holder, the company name, and then the approval number, that is a TC number, and then for the filtering phase piece types, 84A, you may see things like 23C on the filters used on elastomeric respirators. And then there'll be identifying information from the manufacturer as to the part number, the lot number, and then the protection level it offers in that NRP range, and the NIOSH designation as well. That's for certified products. You can check information, and if you're on, seeing these on a store shelf, you can actually go onto the certified equipment list, again, the link there, to look up the approval numbers to verify that approval number matches the product. And as I mentioned, there are pages from the Centers for Disease Control and from Government of Canada and from the company websites that all cover counterfeit issues, identifying specific counterfeit products that have been discovered. So it is a problem, but there are ways to resolve this as well. And just as another, for instance, by the way, the certified equipment list is an extremely useful tool, because if you are a manufacturer and you find you have an issue with maybe a particular combination of chemicals you're having to deal with in the workplace, you can actually also use the list to look for products that have been approved with particular combinations of chemicals. Say you've got mercury vapor and toluene in the same plant. You can actually check all the respirators that will be capable of meeting that have been approved. So it's kind of a nice versatile tool there. And Canadian Standards Association as its approval system develops, it has a similar site. I haven't put it up yet because there's no products that are relevant at the moment, but it will be their general certification site you will work through for respirators in that case. Okay, back to filtration, fit and function, and hope everyone's okay right now.
Yeah. Simon, we're a little behind, so if you could speed it up a little.
Okay, I shall do, thanks.
Thank you.
Okay then, back to the 3 Fs, and just to say, with filtration, how respirators work, the key takeaway is that they are not like tea strainers or nets or sieves. There's a mechanism in the construction of these where you have the effective layer for good filters is a fibrous mat of randomly dispersed fibers, and in many of these there are systems that apply electric charge, dispersed electric charge over the fibers, so that you don't only have the kind of physical barrier of the fibers, you also have electrostatic attraction pulling the particles out of the air. And in fact, that's the sort of force that works better on smaller particles than on larger ones. If you do the rubbing balloon and picking up bits of paper, well, you aren't picking up a sheet of paper. With that, you're picking up smaller pieces of paper, so it works better with smaller particles. So with filters, you have these multiple methods of removal of particles from the air, from sieving, from impacting and sticking, to attraction. And so even a fairly loose fibrous mat can be very effective at removing a wide range of particle sizes. So instead of, again, having a sort of sieving effect, what we're seeing is a plot like this, where we have different mechanisms contributing. And instead of a cutoff, you actually have a minimum level of protection, right where it says overall up there. That is the worst case particle size, as it were, to filter by one of these devices. So the N95 and N95 represents 95% efficiency at that size, typically 0.2 to 0.3 microns. And they use a salt or sometimes oil for the P classes to look at that efficiency. It happens that when viruses are in the air, they aren't, as it were, naked. They're not running around alone. They do tend to stick to larger particles, droplets. Sorry to use that word, but we can say droplets, larger aerosol particles, dust, and so on. That tends to be a much higher size. So the effective filtration you're getting at that size is actually very close to 100%. And that's the same as N95, N99, N100 filters. Those different gradations don't actually make a lot of difference in this case for the efficiency you're getting where it matters. So that's just something to bear in mind. Again, we're talking efficiency, but there's overall factors that required, which are that the respirator must also fit. And for workplaces, that is established by fit testing. You can have qualitative or quantitative. Qualitative is where the wearer can sense a material that is bypassing the filter. Quantitative is where you use a machine to do the measurement. And when products are selected initially, and you have a routine retesting as well, or after any facial changes, that is a required part of the use of or part of a respirator program. Each donning, a respirator seal check should be undertaken. And so that is a check.
And I'll show, and I can demonstrate that.
Dorothy will be demonstrating that. Yeah. Other things to remember are sizing. So respirators do come in different sizes, and if you're selecting one, you should, of course, examine different sizes to make sure you pick the one that is appropriate. Don't just stop at the first one. Noting those approval standards for China and Korea, KN95s, KF94s are actually designed to fit a generally different head form from the Caucasian type. So although it may even do well under its own standards, it may not be the best fit for everyone. And then the difference is mentioned in attachment type. That gives a difference in overall fit capability. Headbands are better, provide a stronger force holding the product against the face than the ear loops. And in fact, the issue is so great that NIOSH will not approve ear loop respirators. So again, you should not be seeing ear loop N95. That's not necessarily a genuine product. And
what is Teresa Tam wearing?
Oh yes, what is Teresa Tam wearing? So she is, and looks a lot like she's wearing an ear loop respirator.
Yes.
So Now, the difference is they are more comfortable. People don't like bands over their head and so on, their hair and these kind of things. So there is this issue here. That's but generally they don't provide as good a fit. Just to mention function. Again, I talked a bit about this, and there's some of the factors that contribute to function there. Particularly fatigue is the big one. But people also, as you see, sort of have problems having irritation from wearing the respirator against their face. And there are problems with ability to perform work as well. That again contribute to less well used respirators, and then again poorer overall protection. I'll skip through some of the other things right now. And on to choosing and using the right kind of respirator. This is where again Canada is very strong. Noting again that we have in Manitoba the 2011 version of the CSA standard. You can go online. I think you can still view this online, but I think I've given this to the 2018 version. But as far as the selection criteria for respirators, they haven't changed between the documents. There's more detail given in the 2018 version, and in my view, a better flowchart. But actually, the criteria are pretty much the same. And that is that in every case, you must assess all hazards. You mustn't just focus, well, I know I've got, I'm handling toluene and I need a respirator for that. But what if there are circumstances where there's perhaps insufficient oxygen in certain parts of the plant, or you maybe have some other process going on that's creating a toxic dust. So you have to consider all of the hazards. And generally for non-biological hazards, where you have a chemical involved, there are exposure limits. And a protocol can be undertaken using known toxicology data to determine the appropriate protection factor that's needed that guides you to the appropriate respirator. And that's a pretty well established guidance that's been in place for 20, 30 years. When it comes to biological hazards, these don't have defined exposure limits. There may be a few for things like wood dust, but for most things, particularly infectious materials, there aren't exposure limits. There's still uncertainty even what the infectious level, how many virions of COVID it takes to get infected. So and that's probably not going to be resolved in years yet. So we don't have hard data to work from. And so the way we've had guidance typically so far has been what we might call expert opinion from government or medical organizations. And as we've seen, that has changed over time. Or there is the control banding guidance that we have in the Canadian standard. And I'll talk a bit about that. Just to talk about those different methods, expert opinion, as I say, is where you have authoritative sources giving guidance, and that has happened for things like tuberculosis and for certain other diseases. But we see the issue that different sources may have guidance that conflicts with each other. And as Dorothy mentioned early on, that some of the guidance we're seeing is certainly not consistent with occupational hygiene principles, precautionary principle, and so on. And really, we've seen a lot of issues with people supposing they have expertise from one side of the problem, but it may not be covering all aspects of the issue. So that's part of the concerns we have now. So issues with expert opinion, but of course it's the basic method that's followed. There's another one called quantitative modelling that has been examined. That's where you try and get as much data as you can about the situation. Particularly the hazard and the exposure environment and so on, and then try and work at a probability of infection using some sort of statistical calculations and so on. And needs a lot of data. It does give you show an accurate assessment, but there's a couple of problems. One, of course, is getting all of the data you need, and the other one is what's acceptable as a probability of infection, which is the output here. Good for comparing different scenarios. If you want to say, if I wear this product versus this product, what's the difference in probability? But as a healthcare manager or a plant manager or even a union leader, what probability of infection would you accept for your workers? That's the problem there. And with control banding, we have a method that is relatively simple, and it can, with some training, can be done relatively easily. It's qualitative assessment method. There may be problems with oversimplification though, so just have that in as a caveat. But what it's really about is where you may have a scale of some factor, be it exposure concentration or level of hazard of potential pathogen. And rather than try and work with detailed knowledge about the value, you band it, you put it in a category. Sometimes between 3 and 6 categories are used to say, we may not know exactly what it is, but we know it's in this zone. And this is created for the pharmaceutical industry when they're developing new materials, and obviously didn't have all the safety data on the material, but they knew it was like another chemical, that kind of thing. So generally you assign these to the different inputs, and we have then a protocol that takes those inputs and works through to give an output. For the biological situation, we're looking at the nature of the hazard, generation rate, and the controls applied. And we have then, for those factors, where we obtain information for the pathogen risk group from the National Institutes of Health, when we then assign on a 1 to 4 scale the inputs for the generation rate and the control levels, ventilation type. I'll run through pretty quickly as time is short. The output you're getting is that hierarchy protection, that 1 to 5 scale that I mentioned before, with a 0 assuming no protection is necessary. There's a 7-step process to go through to identify the necessary output. First of all, confirm that you do have an agent that qualifies for this protocol, and then using the method where you select a wheel, you'll see those in a minute, appropriate to the type of workplace, because there are differences in ventilation between 2 different workplaces. And then we can go through the selection of the different levels appropriate to the bioaerosol generation control levels. So these are examples of some of the biological control levels, and these are based on the National Institutes of Health laboratory scale. This may not be ideal, but it's again associated with risk of disease and the community spread. And some examples there are given for different agents. And then for the generation, we have examples for both healthcare and general industry of activities that may generate different levels to use as inputs. And aerosol generating procedure is the highest level for medical, for instance. And then again, looking at air changes per hour as a factor in determining the control inputs. So broad assessment of these levels, let's say we don't need to know in detail, but you know where the criterion sits on a scale, is then used as an input to these wheels, where you have the quarter of the wheel that's assigned to the risk group of the agent, and then the chord and sectors covering the generation and control levels. I'll give an example of how that works. And your outputs are those numbers there, sorry, the 1 to 4 outputs, or 0 to 4 are these outputs here. Take an example for COVID, where we have identified it as a transmissible disease for the particular job here of undertaking intubation, but in a patient room, because maybe there's not room in a better ventilated area. We then have a risk group 3 generation rate 4 aerosol generating procedure and a control level of 2, that being a patient room. To go through this and identify the segment, we're using healthcare. We're using the quadrant for a level 3, the chord being the generation rate 4, and the sector being the control level 2. Where those intersect is the level that we is recommended by the guidance, and that in this case is a loose-fitting powered air purifying respirator. So we might have from authorities blanket guidance saying use an N95 filtering face piece in all these cases. In fact, this is indicating, because there's poorer ventilation there, that it would be better to upgrade the protection to a higher level of product and have the protection offered by a powered air purifying respirator. CDC, in guidance that exists, says filtering face piece or above, general terms. The California Occupational Safety and Health Administration proposes powered air purifying respirator or above. So this is the minimum level, and you can go above it, of course. That's how this selection protocol works. So just to mention, there is another tool, and this is an online tool that's available. Again, there's a reference later, that was developed from a separate committee in Quebec, follows quite closely the Canadian standard method, and again, takes you through this process. CSA is working on an online tool as well, which will be issued at some point soon. So
And I've just put in the chat the link to the IRSST one.
Thanks very much. Yes, this should be on the last page as well. Sorry, yes. And that's it. We have demonstration donning and doffing. I'll finish this though, so I don't have to come back to it, just to say these are the things to remember. It's in the air, filtration, fit and function all matter. And respirators are the most efficient way to protect yourself and others. And there's some guidance here. This has the links as well, by the way. So these are links to some of the things I've been talking about, standards and reference sources. So I'll stop there. Thank you. Sorry for running on. Thanks. Yeah.
Simon, it occurs to me, can you show the palm method before I do the donning and doffing?
Okay then.
I think that this is this is, and I think another way to come at the respiratory protection issue, and why it might be worthwhile thinking about other things besides.
Thanks so much. Yeah. Okay then. Yeah, this is something actually done a few years ago, and it was to persuade people on committees. As we came up with that standard, that selection guidance, I was actually, I think I led the committee that developed that method. We kind of had to persuade some of the healthcare people on the committee, that surgical masks weren't the best thing ever. So we did this in a way here. Actually, I co-opted, when I had to do a fit test at work, I co-opted the equipment for half an hour and made a few pictures. But really, this is, if you want to think of this as an infomercial at 2 a.m, this is an amazing new product that has proved performance, that fits all the criteria, particularly those criteria of people who are cost conscious and worried about the costs of providing protection for people may worry about. But here's the old N95, if you're familiar with this, and this is a quantitative fit test where we have an instrument that measures the ratio of the particles inside and outside the face piece. The wearer does various exercises, nodding, turning their head, speaking, and so on. And through all of those, you get a score, and that has to cumulatively match or exceed a minimum. And so this is an N95 standard product, very familiar. And you get a number that's pretty good, must exceed 100, 180 in this case, and you see the exercises there. This is a snip from a computer screen. Sorry for the quality of that. So this is excellent fit in this case. It's quite suitable for use. That's, again, it's my annual fit check, 2008. But some people think these respirators are too costly. So we have an amazing product that meets all the criteria. We call it PALM.
Criteria.
Sorry?
Their criteria.
Their criteria, yes. Yes. And that's PALM. This is a personal aerosol limitation module. Sorry, there's a slight lag. There we go. Yeah. And what is this amazing product, you may wonder? Well, there it is. Absolutely free, readily available. Actually, most people have a couple on hand already. Easily cleanable, reusable, and totally environmentally friendly. So what more is there to want? Well, let's just check. How does the fit compare? We did a quantitative fit test on the palm. There it is. Yeah, not quite as good. About 1 in 2 aerosol particles get through. When that sort of level, you only get to the nearest whole number. So instead of 1 in several hundred getting through, we've got 1 in 2, but it stops a few droplets. But sorry, forget, it's not about droplets anymore. It's about aerosols. We have to recognize the science. But people who are ready to dismiss respirators that have got over 100 times protection factor as not necessary would be happy that 50% is better than nothing anyway. So there we go. How does that compare with a surgical mask? Well, I think I've given the answer away already. Yeah, same thing. They're pretty good. That's also 1 in 2 particles coming through, and they stop droplets. Some of them do. And so there we go. We have the interesting situation that the palm is available, washable, reusable, and it turns out pretty well equal to a surgical mask. So if you're currently using a surgical mask to protect yourself from possibly infectious co-workers or strangers, you can save money and the environment by using your palm, just as good. And for healthcare workers, and this is the real kicker, if you are happy using your hand over your mouth to protect you against an infectious patient, you should be happy with a surgical mask. But if not, then you should be looking at an approved fitted respirator. And that's the big difference. And that, I hope, is the takeaway from this talk. There's a big difference there. So,
And
thanks very much.
and then there's Palm 2.
Palm 2, yes. Like Apple, 6 months after the original, we bring out the upgraded version. So everybody has to buy a new one. In this case, doubling up is better than a surgical mask. And you don't even have the problems of contaminated surfaces. So that's to bear in mind. Yeah, thanks. So there we are. And by the way, I had to supplement to it. The fact that you think this is not scientific. This is one-off demonstration for a bit of fun. And actually, yes, it was 14 years ago, 2008, we did this. But it's, repeating that isn't going to make a surgical mask fit much better. You may get, a little bit of variation, but you're not getting up to what a respirator gives. So it's good from that point of view. And then found the CBC did pretty much the same study. They didn't do the hand, but they did a surgical mask, and they got the same numbers. So that's quite entertaining and satisfying to see that this is validated here, supported by the data from the TV show. So thanks very much. Thanks then. Okay. I stop sharing and over to Dorothy.
So very, very quickly, before everybody has to leave, you'll notice that I have in my hand a what's called a N95. Have I got the right side? Oh, who knows?
Yep.
And this is a Canadian-made respirator. And I just wanted to do a quick demo about how to put on and take off, or don and doff, these kinds of disposable respirators, because I see too many people who get enthusiastic about using them and don't quite know what to do. So one of the things is that you need to sort of pull it apart. And some people advise that you stretch the straps ahead of time. I've actually worn this before, so I'm doing this with a slightly used respirator. So what I do is you make sure that the straps are on the outside. And I try to hold it so that I've got my one finger around and thumb around the nose clip and the other around the bottom thing, because it's easier to put it on my chin that way. And I put the top strap over first. You don't have to. The key is that you get the straps around so that the bottom one is on your neck. And if you've got hair like Tiffany does, you want to be sure it's right against the skin. Doesn't make for good looking hairdos, as I can see here. Hang on a second, I've just screwed this up. I do this better when other times. So the other thing is you want to be sure that the straps are flat and that they're really going to stay where where you've got them. And mine has. Okay. The other thing is that I've got a pretty good fit under here, but we want to be sure that we've got the seal. And so you don't do this, because that's going to actually leave a sort of thing like this with the metal clip there, strip. What you want to do is you want to press down with 2 fingers on either side so that it's sort of where your nose hits your cheek. And so I've got the straps flat. I've got the bottom one against my neck. I've got a pretty good, I've worked on it here. And for those of you who wear glasses, you can check and see if your glasses are fogging up. Now, if you're like me and you're huffing and puffing going up and down stairs these days, that may not tell you very much about a leak, but I think that I need to do that. So if the glasses are getting fogged up, it means that the nose clip needs to be adjusted. You've got air coming out there. And you can also check the headbands. The quick test, the test that Simon talked about, is putting your hands over the respirator and doing sort of some in and out, and making sure you don't feel any air escaping around the edge of the respirator. For the guys in the crowd, you can keep facial hair as long as it's not on the edge of the respirator, because that's going to really leave places for the air to get in. So this one fits me quite well. I wear it regularly. To take it off, I find it easier just to take the bottom one off first and then to do that. Now, there's all this warnings we've got about don't touch the respirator. Because of the material that's used in this, if there are particles in the air that I've inhaled, they're going to be caught in the material, not on it. So if you happen to get your hand on the thing, don't freak out. But it is better to just sort of hold it by the edges. For those who really can't get regular replacements, a number of companies and organizations have recommended that you get, say, 5 if you're working 5 days a week, and that you have 1 for each day, and then you put it in a paper bag, not plastic, because that's going to deal with humidity, increased humidity, and just number them and recycle them. These things can be used over and over again, as long as they don't get wet and they're not dirty, and that the straps are still working. And so you need to take a look at them each time that you put them on. So, the other thing is, you'll notice that I took my headset off. You need to put the respirator on before you put on a hat or put on a scarf. This is what I've seen my neighbors doing. She's got one wearing a wonderful little cap, and she's got the respirator strap on it. So what it means is that it's not nearly as good a seal because it's not against the head and the neck. So Monica had to leave. Sorry, I've been trying to keep track of the chat here. So there have been a few questions. Risk of bacteria from our breath food particle growing in the mask. I don't know. I mean, this is why it's, if I had my druthers, I'd be wearing not wearing a disposable because we don't get into some of these concerns. I don't know that there's going to be much there, Jane. Janie, Simon, what's your thought on that? About
this is sort of on what things growing on the
yeah, but risk of bacteria from our
Yeah.
breath and food particles growing in the mask.
I think that first of all, it's a fairly hostile medium. These are generally water repellent media, so that that are used for the actual filtering materials. There may be more water hydrophilic materials used in the parts that are closer to the skin. But I think in the time frame we're talking of the use of these products, you aren't going to see bacterial growth or problems like that.
Right.
This can be a problem, in a building filter where it's in place for a long time and not changed, but not in respirators. I should mention there are some companies that do market products claiming to be some kind of viricide or bactericide material coating on the product. These have been around for years, and for whatever reason, they don't seem to have any long life on the market. And there are concerns when you have those kind of materials involved of what the effect of having those close to your skin is going to be.
Right. Well,
the irritation effects. So,
well, I would suggest that anything that's vericidal is toxic because of what it's like the disinfectants, many of the disinfectants that we're using, and you're risking a bunch of health issues. So there was a question, thanks, Jack. There was a question about the dashing, is that right, respirator? If I'm just going to share my screen because which Manitoba Health has said people can keep using, even though it's, hang on 2 seconds here, even though NIOSH has stopped its approval. And so this is the document that somebody gave us a link to. What's interesting here is that Shared Health is saying that these respirators are meeting all NIOSH standards for breathability and particulate filtration efficiency, as well as this ASTM thing. What they don't say is the reason that these were not, the validation was taken away, the certification was taken away, is that they had crappy quality control.
Yeah.
So it's all well and good to say they met tests, but you couldn't be sure that they'd meet them every time.
Yes.
It's sort of my explanation. So I think that shared health is not consulting a hygienist here, if that's if that's their explanation. And
as I mentioned, the approval that NIOSH gives isn't just on the performance of the product; it's on the overall manufacturing process and continued sustainment of that quality. And yes, you can pull some, and if they're a particular brand or a particular lot, you will get good results. But yes, as they pointed out, they failed a side audit. They didn't fail individual testing. So the NIOSH is this embracing organization that is really good from that point of view.
the other thing is that shared health clearly doesn't understand that there are other things besides disposable respirators that people could be using, and that they are not in short supply. On the other hand, Ethelinda, so nice to see your name there. It's been a while. Ethelinda and I met back in 2003. She, like me and a number of other people, have been told to remove an N95 when they're going into a hospital and given a surgical mask. So, and she says, I was told it was their policy. Yes, you're not the only one who's encountering this. And she said, I wasn't going to do that. They said that the mask, put it over your N95, as I can't come in without a medical surgical mask. Well, that's what I did, except what I did was I turned my back. I sort of looked like I was putting the thing on, turned my back to the poor guy that was telling me I had to do this, and didn't actually put it on. And nobody challenged me in the local hospital when they saw me wearing my N95. I actually had surgery, and they kept the N99 actually for me for when I came to. It's Simon. I think that, I mean, the people who are saying this are not the folks that are making the decisions. So that's not their,
you can't really fight.
You can't blame them personally. But you can blame the policy, the folks who are making those further up.
And unfortunately, well, it's from what you were talking about early on, and this is something we've seen nationally, internationally. It is this infection control presumption, and some of this is based on 100-year-old studies that of the short distance droplet spread and the need for source control, and the fact that a surgical mask can protect you from direct splash. That's what they're thinking of in terms of the way the infection transmits, and it has been shown. Now, how many years of data do we have with COVID? I think a couple of years data showing aerosol transmission is a reality, and that is still something that people can't get, I guess, they can't accept and can't put into their protocols for their workplace. It really needs to change. And we could comment the SARS Commission report sort of laid a lot of this stuff out, saying this is how it should be done, and that has been largely ignored after the first SARS outbreak in 2003.
Yeah, and in fact, there's a guy called Michael Klompus, who's a doctor, infectious disease doc in Boston, who was on the droplet dogma end of things and writing quite fiercely about it. Who came to the realization that aerosols really are what matters. When he saw people getting sick around him using surgical masks, and those with N95s and other respirators not. And if people are interested, he's written some papers about it. There was one question here that Tiffany put in, that some folks asked before, if we can't get an N95 or another respirator, I assume, what about wearing a double medical mask? Is that helpful?
It's well, it's, as we might say, slightly better than nothing, but it's not going to be, a medical mask isn't going to be that great. If you had the chance to get even a KN95 ear-loop type product, that would be better. Doubling up is being talked about, and it's something really the capability can go in two directions. It can improve things because it can get a better pull of the mask to your face, or the product to your face, and get some better fit that way. But sometimes, if it's not done right, doubling can actually dislodge the product from the face, and so you get poorer fit. So it's a tough call. But I'm sorry to say that I don't think 2 surgical masks is going to give you a lot of benefit over 1. Slightly better, but there are properly available, if you can get them, better ways to get protection than that. If you can't get the filtering face piece type product. Sorry about that. Thanks.
Yeah, sorry, I just stepped away to get this. This is called an ear saver. And if you don't have a choice around, at least, you know, at the moment, something like this, which will essentially pull the straps back and make the loops more like straps, right? The 2 straps, you can jig something up. It doesn't have to be this specific kind of product, but you can see what it looks like. This is just made with a 3D printer. Somebody asked about facial air. I'm sorry.
Well, I'll mention the braces as well that you can get for surgical masks that can help as well. Sorry, yes. Okay. Sorry.
Some people wearing a bandana. So that was my point about the definition of mask. Bandanas do bugger all. Think about it. If you were standing beside someone wearing a bandana and you were smoking, whatever your choice of smoking material is, do you think they could smell it? And I suspect they can. And that's because the particles in the air from that this virus comes in are like smoke. And those bandanas will really do nothing other than stop you spitting on people, probably, and hide your face. And it's really, I think it's totally irresponsible. In this co-op I live in, I've asked the board of directors to not allow in the contractors I've seen who come in wearing bandanas, because I don't want to take the risk, and I don't want them getting sick either. Simon, any other thoughts on? Sorry, I get vehement about that one.
I see one question on exhalation valves, and I can just share quickly if it's working. I'm afraid I have some, and maybe Tiffany trying to call me, but I can't take the call because I'll lose my audio. Here's a summary of a report from, again, the lab that NIOSH, the organization, does the approvals. I do have a slide, but I didn't give it on NIOSH. It's also a research organization as well as being the test lab and approvals agency for the US. And so they do ongoing studies. This is one showing some work they had done on modeling the dispersion of material from a filtering face piece, FFR, with and without a surgical, sorry, without and with an exhalation valve, and then also from a loose covering like a surgical mask. And yes, the question of having an exhalation valve and the potential contamination of a sterile field is an issue. Some of the things that have been said about exhalation valves, I think, are alarmist. They aren't just an open hole that everything can come out of. They generally have a convoluted path. So anything in the way of larger droplets that may be spat out by the wearer aren't going to make it out because they'll hit some kind of baffle and barrier. But still, yes, you will have some escape. But an issue is that the escape you get from a loose fitting product is far higher than from one with an exhalation valve. So the people, again, we have who are raising concerns about exhalation valves in healthcare are quite happy using surgical masks, which are far worse. It's, again, that double standard and this, unfortunately, attribution of magic capabilities to surgical masks. So yes, they are not ideal. They're not as bad as a surgical mask, but still they would not be recommended when you want to maintain a sterile field. However, it's not the end of the world if you do have products with an exhalation valve, because a very easy solution is to put tape on the inside of the face piece to cover the valve, and so that means that the exhalation breath will move out through the filter material. And you can see there's a chart there, and there's a reference to this study done at the end of 2020 at the bottom, that's showing the relative capability for control of the exhalation or the penetration outwards for different types of covering or blockage of the route through the valve. So in fact, covered over and taped over is far more effective than putting something on the outside to try and stop it, because it obviously prevents anything getting through. So that's that.
Yeah.
So yes,
there is a question here from Darren who says, when you mentioned no facial hair on the outer sealing surface, I've seen many facial structures that seal at the jawline and are loose and open at the outer seal. Does this mean that they have to be clean shaven at the jawline or chin, as that is where the sealing surface is? I think there's sort of a couple of questions in there. Darren, I'm not sure if you're still here, but one of the things that seems to me to be getting to is this issue of Simon's face is a different shape than mine, and it's a different shape than Tiffany's, and it's a different shape than Andrew's, and I'm just picking on people who are here, whose names I can see. So the trick in a workplace is that a good respiratory protection program has a variety of respirators, not all disposable ones, and that if you don't get a good seal when you test with a disposable one, that you can move up. And there's nothing, the Texas infectious disease hospital has been using elastomerics, sort of the standard respirators for years, more than 20 years. The University of Maryland uses it. If you're in healthcare, there are these wonderful halos from Clean Space that are an example of what could be used. But I think, Simon, the issue with the facial hair is that it breaks the seal, right?
Yes,
so the trick is we're trying to get a seal.
Yes, that's it. And I think the Canadian standard, again, there's a link to the online viewable version of that. That is one of its annexes, does have images of types of facial hair, showing what would be, likely to be capable of being fitted properly and things that aren't. So that might be useful guidance as well.
Yeah.
But it is the importance of that peripheral seal. Yeah.
I've got a nice graphic that comes from the States about what might work or what might not. No goatee, no, because unless the goatee is sort of something that's like, and that sort of really is just a little under the chin thing that doesn't come down to the actual chin.
Yeah.
We can include with the presentation PDFs this graphic that I've got that comes, actually it's adapted from NIOSH, that's really shows the different kinds of things that might work. So Darren, sorry about that. Just before we go, any other questions? I'm so grateful that so many have hung in here this long. For those who didn't, there will be a recording and we will have the PDFs.
Dorothy, can you take care of the last question? What are your thoughts about N95 disposable for exhale valve?
Yeah, that's what Simon just talked about.
Yeah, that one. Yeah.
That's where what you do is, if you do have one, just put some tape over the inside and you're not going to be breathing anything out to worry about. How's the seal affected by reusing the N95? That's why you do that seal check each time you put it on. And that's, you check the straps, you do you check with your nose pieces in the right place. That's my advice on it. Simon?
Yeah, that's pretty much it. Yes, provided it's not been grossly deformed through being squashed or in handling, that it should be good. Yes.
Yeah, I discovered chocolate ice cream on mine the other day. I don't know how it got there, but that's not one I'm going to reuse. There's a picture in the CSA standard that shows acceptable. Yeah, and Vinay
actually, I was just pulling that up. Yeah.
Put the link to the NIOSH one. Infographic about this. Oh, Simon's going to show it.
This is the Canadian standard. Sorry, I'll just try and zoom it out if I can get rid of this. That's it. So yeah, so it's showing ideal clean shaven, limits to facial hair growth, and then
even
styles
a stubble, even stubble is going to make, in fact, because hair on facial hair is thicker than the hair on your head, I understand. And that means that it increases the odds of the seal being broken or just not getting a good fit.
Yeah. So there we go. Yes. Different
Okay.
sort of moustache and beards. Yeah. Okay.
Last call, folks. Great. Thank you so much.
Thank you. Yes.
We'll
Okay.
send Tiffany PDFs, and Simon, you should know I made an offer that if the Safe Work Manitoba folks want to hear more about this, that we can do this with them. And if others do, I'm sure that we can organize something to help out. I just think this is so important that when it comes to protecting workers in this pandemic, we have to start with the premise that the virus is in the air, and that means we need things that clean and filter the air in various ways. And we need, these days especially, we need multiple layers. And that's where that infographic from the coalition, the 2-page handout thing that I put a link to earlier, is useful. And we can include that in the package of stuff that we send. And again, thanks especially to the folks that whose names I recognize, people who I knew from my days in Winnipeg. Wonderful to see so many folks out. Thank you.
Mm-hmm. Thank you.
On behalf of the Occupational Health Center, thank you, Dorothy, Simon, and all the folks here joining us and really participate in the session and bring out all the questions and sharing all the information with us. So the packages with the record session, the link of the all the resources, everything, and the PowerPoint will be all sent out to you once this is available. So take care, everyone, and then see you next time. And
right. And you're doing more on ventilation, I understand, as well. So that'd be great.
Yeah.
Great.
Thank you very much, everyone. Nice.
Bye.
Thanks. Thank you. Thanks, then.
Simon, hang in there. I think we're gonna.
Okay. Sure.
But I don't want to record that section. I have to.
So you can turn the recording off.